Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today I'd like to share with you why I became a chiropractor. So when I was, I would say in my late 20s, I worked at a job where I had to drive all day, and I was, constantly in the car. And I remember driving down the road and just had a terrible, ache directly between my shoulder blades. It was something that you just couldn't move to get rid of. I didn't feel like I could take a deep breath, and I kind of lived with it. It's one of those things. But this day, I remember it was particularly worse. And I was just driving down the road, and I was out working, and I was in sales at the time. And I drove by came upon this office, and there was a chiropractic office, and I was like, I had no idea what a chiropractor was. I just knew that they helped with back pain. And I was like, I wonder if they could help me. I had a lot of the same. I didn't know anything about it really, not much except they worked with back pain. So I pull in and I go into the office, and I was able to get an appointment. I was like, do you guys by chance have anything available today? And they were like, yeah, we can see you. What's going on? They asked me a few questions, and they were able to see me immediately. So I filled out some intake forms. The doctor, I met the doctor. He did an exam with me. I told him what was going on, and he said I had something called T4 syndrome, and he was like, it's due to mechanical stresses, and it's because you're driving with your arms up, and you're sitting, and it puts a lot of mechanical force on the upper back. So it's about like right between my shoulder blades up to the bottom of my neck. And he said that area, there's a lot of mechanical pressure. Those muscles are really tight, and especially driving and sitting all day, it's what's doing it. So he looked at me. I did not need x-rays, which he was like, this looks like it's a mechanical stress thing. We can help this. The exam did not indicate I needed x-rays. So he took me back to the adjusting table. And so I had no idea. Like he told me, like I had no idea, what they were going to do when I first walked in, but he explained to me in the examination. He was like, look, well, there's several different things that we can do for this. One of the things that he recommended was actually a spinal adjustment or spinal manipulation. And I knew a little bit about joint manipulation, and I knew that it had been used, it's dated back thousands of years, and that there's a lot of research on it. I mean, I have a background in exercise and fitness, so I knew a lot, and I knew several things. But he was like, look, what we do in our clinic, and he was telling me like, what I do in my clinic is I don't do the by hand adjusting that makes the bones pop. He said that's perfectly fine, safe, it works really well for people. But he used an instrument. He actually had a mechanically it was electrically driven instrument that was percussive, and he was like, this is really it's the instrument. We can place it on the spine very specifically and just pull the trigger for it, and it just creates a really quick pulse, and you can control the force. He's like, listen, it works very similar to the by hand, but it's really gentle. You don't feel as much, and it should help you out. So I lay down on the table, and he uses his hands and he feels through the spine. He just did an exam with me anyway, so he knew he'd already felt the musculature and taken me through some orthopedic testing. I mean, everything was really well done, and so he checked that area of my spine, and he used the instrument directly on my spine, and it actually felt really good. It was almost, you're laying on the table, you're breathing, you're relaxing, and he was using the instrument directly on the spine and on some of the surrounding muscles. It took us about, I would say, for the treatment, 3 minutes. It was very short, and I noticed when I was laying there, nothing was uncomfortable, nothing hurt. He said, okay, you can come up off the table. So I sat up, and when I stood up, I was like, okay, am I going to feel anything different? When I stood up, I felt a lot less pressure in my mid back. I felt like I could take a deeper breath. That was probably one of the most noticeable things. I took a breath, and I felt like my ribs just expanded more. I felt more relaxed. I did not have the same kind of pain. It was probably, when I walked in there, a dull pain of like a 6. When I left, it was probably a 1 or 2. And it was very, very instant for me. So I was shocked. I was surprised, and I was really interested then in chiropractic and what it was. And so he had given me a little bit of background, but he didn't, he wasn't sitting there teaching me everything about chiropractic. And he just basically told me, this is something that may come back. Try to make sure you have good lumbar support. Gave me some tips on how to avoid it, and that was my first experience, and I was absolutely blown away and amazed by it, at how quickly it helped. And I noticed that whenever I was driving, I got back in my car and I was driving. It's like, man, I feel so much better. My back was noticeably improved. And I was just remember that whole day, it was like I could breathe better. It was like the lights were turned on. I felt so much less. Sometimes you don't know how much tension and discomfort you have until it's gone. And then you're like, wow, I can't believe I was living with that. And I remember that weekend, I think this was on a Friday, that weekend, over the next several days, I slept so much better. I remember telling my wife, I was like, I can't believe how much different I feel from that. And so that got me interested in chiropractic, and I started, because I already had a real interest in exercise and fitness. I studied the exercise and fitness starting when I was 12. And this was when I was like late 20s. And I had studied exercise and fitness, worked out routinely for that entire time, and this was like a perfect thing for me. I realized, I was like, man, I could help a lot of people. I could apply some of my exercise and rehabilitation. I'm really interested in this stuff. I'd like to learn more, and that's what led me on the path of becoming a chiropractor. I looked into different chiropractic colleges. I already had a 4-year degree, but I needed to go back and get some of the pre-medicine classes that I did not take with my undergraduate. So I had to go back to school prior to chiropractic program because they required pre-medicine. I had to take organic chemistry 1 and 2, had to take college physics 1 and 2, which I didn't have to have those, and then I actually had to take general chemistry 1 and 2, college level general chemistry 1 and 2, organic chemistry 1 and 2, college level. These are weed out classes. If you don't know what that means, they're tough, and they were hard. And I took them in a condensed summer session. So I did 6-week classes, what's usually an entire semester, organic chemistry 1 and college physics 1 for 6 weeks. Both of them in 6 weeks, and then organic chemistry 2 and college physics 2 in 6 weeks. And that was probably the most brutal academic period of my career ever, even through chiropractic college, which was very rigorous. A huge course load, lots of material, but that was probably the most rigorous. So I had to take all those classes, get my prerequisites in, and then I applied to a chiropractic college. They accepted me, and I went to school for about 4 years then. Did an internship, and here we are. So, working a lot with people to help them improve. Our main focus is to help people get out of pain and improve their function as best possible, to recover from injuries so they don't heal back wrong, and just do it, as naturally as we possibly can, to just let the body work and have optimal function without having to use external things. I mean, thank goodness that medications and things like that are available to us. But as a first line approach, if you've got a problem that can be improved without taking those things, I mean, that's a pretty good way to go, because it can really naturally, working with the body and not forcing chemistry upon it externally, is like working with nature. I mean, that's how we're designed to work. So I just try to honor that and work with the body as much as possible. There's a time and a place for everything, and we want to always keep that in mind, that we need to do what's appropriate when it's appropriate. But I want to share with you guys anyway about why I became a chiropractor. I hope this helps you to better understand a little bit more about me. If you have any questions about anything, or if you'd like to see if I might be able to help you with your problem, just give us a call. We'll be happy to help you out. But I hope you guys have a great day. Talk to you soon.